All right, hi there. Welcome to the Town Meeting Program. This is being presented on July the 9th, Thursday, brought to you as always by Cordova Wireless Communications, which is your local cell phone and wireless data provider. Also the provider of your local talk program, which we do on demand when a pile of paperwork calls for it or when you call for it. If you have an idea for a show that should be done, you're always welcome to make a recommendation for a guest, or if you want to be a guest. A person doesn't have to hold office or have a degree or something like that to be a guest. And our subject today is going to be this increased activity around COVID cases in Cordova. Obviously, an area of concern, and one that we are, of course, continuing to discuss with our local experts, members of the incident management team like Dr. Sanders and Mayor Copeland. We continue to share the documents that are put out by the incident management team. And in fact, the one today, I thought was signed by the city manager, but I may be remembering that wrong. At any rate, this is information that came out yesterday. And I'll direct you to, while I'm thinking of it, to the last couple of updates, daily briefings, particularly the one yesterday. If you go to youtube.com/Cordova TV and find the daily briefing for July 8th, you can hear some of the initial reaction from both Dr. Sanders and Mayor Copeland. There is an outside chance, I say outside because she's probably one of the busiest people in the state, but there's an outside chance I might get to visit with Dr. Zink a little bit about this subject of contact tracing. And when you find a case and are able to identify it as from a traveler or community spread, where somebody in Cordova passes it to somebody else in Cordova, how you go through this process of tracking down the person's contacts and letting them know so that those people can check in and get tested. And some of that is covered in the documents that we're going to share today, because that's been a question a number of folks have had on social media. And a lot of times, of course, you can judge or gauge the level of concern in the community by how robust the rumor mill is, which has been fairly robust here recently. And while it's always unfortunate, particularly when the rumor mill is in print and, just available for anybody to see, while it's unfortunate, it's not like it's beyond understanding why that happens. It's natural for people to be concerned and to sometimes speculate when the information they want is not readily available, which unfortunately in this situation is just sometimes how it works. It's frustrating, but putting out bits and pieces of information like we have kind of grown accustomed to big national media companies doing, like, for example, if there's a school shooting somewhere in the lower 48, all of the media show up and they all start throwing out bits and pieces of information before anybody knows anything. They don't know. They have no idea what the facts are. So they just start spitting stuff out, which when you are a professional so-called journalist is very unprofessional and very stupid. But, those of us just in the regular public talking amongst ourselves, which is kind of what social media feels like. Again, it's understandable. It'd still be nice if we could sort of contain it, maybe make those conversations in this new world of social media, maybe make that speculation a little more private rather than out in front of everybody. But, everybody's going to have to follow their own instincts in that regard. But my point in bringing that whole thing up is that the idea of contact tracing is obviously on people's minds. There are some people who think it's something that should be able to just happen immediately. there are people who are saying that Cordova has very low-tech testing that takes 4 days, which actually isn't true. That may have been true a while back, but that hasn't been true in Cordova for quite a while. Most of the tests that are done in Cordova come back in less than a day. So we'll go over some of that stuff. And again, cross your fingers, we may be able to talk to Dr. Zink about contact tracing sometime in the future. So here's what the news release says from July 8th, which was yesterday. The Cordova Medical Response Team identified a third active positive result during screening on Tuesday, July 7th. The individual involved in the most recent case is a Cordova resident who took advantage of free COVID-19 testing. The individual is asymptomatic and is in isolation at this time. The individual, who is a City Hall employee, is cooperating with medical officials, and contact tracing is ongoing. City Hall and the Cordova Center have been closed to the public since April, and the mask mandate has been in effect for everyone, including city employees working outside of their homes. As a matter of precaution, City Hall and the Cordova Center will be closed for the rest of this week to deep clean and disinfect the buildings. During this time, City Hall employees will work from home and self-quarantine until they receive test results at the end of this week. As a sidebar, the reason for that delay, why they have to wait to get test results, is in order for the test to be effective, the virus has to be in your system for a little while, which again sucks to have to wait. If you think that you possibly contacted somebody recently, you want to know right away, but it's got to build up in you a little bit before it shows up on the test, which is why they, and we'll get into this later, which is why they ask that travelers go ahead and isolate themselves for a little while waiting on a test result, or waiting that minimum amount of time that you need to wait until you get tested. And again, we'll elaborate on this in a little bit, but at any rate, that's the reason why you have to have that delay. If you test too early, it's just going to be a false negative. Moving on with the news release. This is the first community spread identification of COVID-19. All individuals who shared close contact with the infected individual have been contacted by health officials, notifying them of the next steps for testing and quarantine. The City of Cordova and local medical experts are in close contact with the state of Alaska and the Department of Health and Social Services to address the influx of cases in this community. The state has offered its support as needed. City Manager Helen Howard said, "We still have a long way to go before the end of this pandemic. We must remain diligent in our safety practices. Given the nature of the virus and how easily it's contracted, it's highly likely there will be more cases in our community. We cannot let our guard down. The goal is to ensure the cases are isolated to that individual and do not spread." Let me add another quick sidebar to that part where the news release said that the city is in contact with the state. I noticed a comment on one of the social media posts that said something to the effect of the state doesn't care about this little town of 1,800 people, and basically they just ignore us and shrug their shoulders when we say that we have trouble, and that just isn't true. The state has been very interested in Cordova's plans, in how things go with Cordova. Dr. Zink, Senator Sullivan, Senator Murkowski have all been in regular contact with at least the mayor, if not other members of the council. I don't know if their primary point of contact is the mayor. Dr. Zink and Mayor Copeland talk to each other fairly regularly. So people shouldn't think that the state doesn't care about what happens here, because there's just not any evidence to support that. Moving on, the Cordova Medical Response Team reminds the community it has the power to control the spread of the virus. In other words, us, the people, we have the power to control the spread. Each of the following actions is proven to decrease the transmission of COVID-19. Wear a face covering over your mouth and nose when in public spaces. Socially distance by at least 6 feet. Self-isolate and use curbside or to-go deliveries. Maintain a small social bubble and only frequent public places when necessary. Diligently wash hands throughout the day. And wipe down often touched surfaces with disinfecting wipes. This is something we talked about yesterday on the briefing, which is even if there are some cases, even if we have some community spread, even if there aren't mandates that close businesses or force stay-at-home orders, that kind of thing, each of us can choose to behave as if everything was mandated to our own individual greatest extent. For example, even though grocery stores are open, it doesn't mean you have to go in them. You can go ahead and take delivery and not have to come into contact with much of anybody in order to get your groceries or other supplies. Lots of places are doing curbside delivery. There are still a lot of folks that are willing to help with getting you groceries or getting your mail or that kind of thing, especially if you're in one of the vulnerable populations or you're just nervous about being out. That's absolutely fine to be extra cautious and extra protective, even if that level of caution is not being mandated. So when the medical team says we have the power to control the spread, that also means each of us has a great deal of power to protect ourselves from any potential spread. So for what that's worth. Now, to cover again this business of close contact, this is something that people were asking about on social media. I'm pretty sure in one of my conversations with Dr. Sanders that they're getting a lot of questions about this in the Cordova Prepared email, which is still a thing, by the way, in addition to 424 info. When you have these questions, you can utilize those. But let's go over this again, because what happens is in contact tracing is that when a person that tests positive is identified, they immediately ask that person to identify anyone and everyone that meets these close contact criteria so that then the contact tracers can reach out to all of these people directly, not by notifying me and having us announce something, or they reach right directly out to anybody that's a potential close contact, tell them you may have been in contact with somebody who has tested positive, and then they provide instructions, on whether to come in and get tested right away or self-isolate for a few days and then come in and be tested, and so forth. So here is the summary again from our local team of how that works. According to CDC guidelines for COVID-19, a close contact is defined as anyone who was within 6 feet of an infected person for at least 15 minutes, starting from 48 hours before the person began feeling sick until the time the patient was isolated. That's kind of a brainful. Let's do it again. Close contact is defined as anyone who was within 6 feet of an infected person for at least 15 minutes, starting from 48 hours before the person began feeling sick until the time the patient was isolated. Now, if you are concerned that you were a close contact to someone that may have been in contact with a positive individual, they don't recommend testing at this time. Continue routine care, avoid social gatherings and close contact, remain 6 feet from all contacts outside your household bubble. If you develop fever or COVID symptoms, please call your health care provider. This has to do with the not overrunning of the free testing, which is still technically available for everybody. But if too many people come in and get tested who don't really need it, then that testing system gets overrun. It starts to delay the results. And what may end up happening is it won't be testing for everybody anymore. They'll have to pull it back and have it just be for contact tracing or people coming in from out of state or that kind of thing. This goes on to say that masks reduce the contact risk for close contacts, but masks don't change recommendations for testing if you are within 6 feet for 15 minutes or more of someone who is COVID positive. So even if everybody was wearing masks, they want to check you anyway. So again, the key thing, if you want sort of a brief little snippet summary, it's the close contact being defined as being within 6 feet of an infected person for 15 minutes or more. That's considered the proximity and the time in proximity to possibly ingest enough of the virus to actually become infected yourself. So that, again, is about it. Didn't take too long. And as far as the gut reaction, the emotional reaction, I mean, there's no question that this sucks. I know that, a lot of us hoped somehow we would, dodge the bullet in terms of any community spread. And by all accounts, Dr. Zink included, we've been doing an extremely good job of that. But they've also said, our local doctors and the state officials have said that it's practically inevitable that at some point, whether during the summer, during the fall, during the next winter, that there was going to be some community spread. That doesn't really surprise anyone, even though, again, it's kind of a smack in the face when you hear, oh, geez, it actually has jumped from a person in Cordova to another person in Cordova. Nobody wanted to see that happen. But I think most of us knew deep down that it was going to. The only way to avoid it would be, to build a big wall around the town and have nobody come in or go out at all, period, until they come up with a vaccine or they come up with a medical treatment. And I know, obviously, I'm sure most of you know that work is being done on that constantly. And in fact, the number of people who have had to go into the hospital that have ended up having this be fatal has gone down, despite the big upward trend in case numbers. The fatality rate is nowhere near what it was. Now, fatality may be the worst outcome, but it's not the only outcome, as we've seen in some cases for folks who may end up with longer-term lung issues or, a number of potential outcomes. Again, it's a new virus still. We've been fighting it for a number of months, but it's still new. And obviously we want to avoid getting it. But even though logic is not really a fun thing to evoke in a situation that creates worry like this, the logical truth is, short of putting a giant bubble around the town, it was inevitable that it was going to show up. Flattening the curve was never about people not catching the virus. It was about making sure that the hospital system, the medical care system, didn't get overwhelmed. The meaning of flattening the curve seemed to kind of morph as the whole reaction to the virus has evolved over the months to let's be sure we don't overwhelm the medical care system to let's try to make it so nobody catches it, period. And unfortunately, that's just not very practical. But again, doing everything that we possibly can to keep it from spreading around through all of these protective measures that have been proposed and either recommended or mandated at different phases. I mean, really, to me, and it's just my opinion, but to me what it comes down to is each individual looking at the landscape and making a risk assessment that is comfortable to them. In other words, if the possibility of catching the virus really scares you, that's fine. I mean, it sucks, but it's fine. And you have every right to be as protective of yourself and your family or your close contacts as you want to. Again, just because things are open doesn't mean you have to go. Just because you're allowed to go in the grocery store doesn't mean you have to. You can take curbside delivery. You can isolate yourself. And two, because a lot of us are concerned about friends, it's not just about us whether we get it, but you've got friends, particularly in the vulnerable population, that you don't want to get it. Share your strategy with them. Call them up, send them an email, whatever. Look, I'm really concerned for you. These are the strategies I think would be best for you to follow. These are the ones I'm following. I hope you'll do that too, so you don't catch it. Because by following these guidelines with masks, with distancing, washing your hands, washing your surfaces and stuff, it really does. If you do all that stuff, it really does make this difficult to catch, even if there's an outbreak, which we certainly don't have yet and hopefully won't. So you should feel absolutely free to take precautions, regardless of whether it's a landscape with lots of spread or not much spread, in order to protect you and yours. And two, I feel bad for people who are being subjected to jerks. These people on both sides of the shamer types. To hear these stories about somebody, say, wearing their mask in the harbor and having people who aren't wearing masks jeer at him. Oh, you wimp, a lot of the pejoratives I can't use on the air because they violate the license. But, you can think of nasty words for wimp, scaredy cat, that sort of stuff. That's just stupid. In the same way that people fly into a rage over someone not wearing a mask. But you're always going to have people on the fringe on both sides of something like this who are not going to behave, either because they're scared or just because they're ignorant or whatever. But I hope that those of us within those fringes, more to the center of those fringes, will just kind of mentally go, okay, that person has issues, then their behavior is a reflection of them, not a reflection of me. And just kind of mentally pat them on the head and move along. We all went to elementary school. We all know what the knuckleheaded bullies are like. People trying to scratch for power, a sense of giganticness or whatever, and it's part of the human condition. So we will see how this evolves. And, of course, we'll continue to keep you informed through the daily briefings, through talk shows if they're needed, always with guests when that's possible. We're hoping, like I said, maybe if there's time, sometime in the near future, to be able to put a few questions to Dr. Zink. We may also sometime in the near future, depending on how things go, have a roundtable with our local doctors, a roundtable show, and have them answer your questions, which we will collect from email and from Facebook. It won't be a call-in thing because those just don't work. We've tried to do those in the past, and when it comes time to actually picking up the phone and calling and being on the radio, a lot of times people's nervousness overtakes their interest in the issue. So we've just found through extensive decades of experience. I've been hosting this show since 1992. I've learned a thing or two. But taking questions by email or having them Facebooked in or something like that is very effective, actually. And so we may have one of those, and I'll give you notice so you can prepare questions and send them in. And then whether we're visiting in a roundtable with the doctors or whether we just have Dr. Sanders on during a briefing, we can bring those up. Now, don't substitute sending questions for future radio shows. Don't substitute sending that stuff to us for sending it to cordovaprepared@yahoo.com. Remember that important email address. Or asking those questions at 424-INFO. That's how you get to the incident management team and get answers directly from them. Any questions that we collect that are sent to us are meant to supplement that. But I would say unequivocally that any question that if we put out a solicitation for questions and you send one to us, at the very least, send a copy. I mean, use that CC feature on your email and copy CordovaPrepared@yahoo.com. So you get answers from as many expert sources as possible. And everybody is pretty much on the same page that's a member of the IMT. So we'll call it good here for today. Thank you for listening. If you missed any of this program, it will be uploaded as soon as Robbie can do it at youtube.com/CordovaTV. That's our Cordova TV YouTube channel. The show was brought to you by Cordova Wireless Communications. Very valuable asset to have along with CTC in terms of keeping money in town and bringing outside money into town that can then circulate around in our economy. We will bring you all programs that were delayed in the 10 a.m. hour, calendar, Tradio, Fish Radio, all those things that normally come up. We'll get them all into you. And we'll see you for the daily briefing. First one this afternoon at 1. Those air at 1, 5, and 8, roughly, on the radio, and then they go to youtube.com/CordovaTV as well. Have a great day. Be safe. Do what you feel like you need to do to protect yourself. Our best thoughts remain with you, and thanks for listening to Town Meeting.